I run a number of businesses. Baxter Williams is my principal business, which is a employee engagement and recruitment consultancy based in Worcester. Even though we're based in Worcester, we work internationally, but we are very proud of our Worcestershire roots, and we're very proud to support the Worcester economy. What I thought I'd do today is talk a little bit about my journey in creating a business and a project called Covid Safe UK. Clearly, when Covid hit us, it was the largest piece of disruption really to hit the economy since 2008. We had no forewarning. We didn't have any chance of putting a plan B or a plan C in, and we were left looking at a landscape which had changed dramatically. And I actually remember my COVID. Everyone probably has a COVID moment when they realise that COVID was here to stay. I normally take a couple of tables at Cheltenham races every year and take my employees and my clients. And I took a table on the Tuesday, and everyone was talking about, we're not sure if Thursday is still going to go ahead at Cheltenham. And I remember being in the taxi on the way there thinking, actually, it just doesn't feel safe. And if anyone's been to Cheltenham before, the press didn't really know what was going on with COVID. And I think they were spoon feeding us bits of information, and everywhere seemed to be a lot worse than it was in the UK. But when you walk around Cheltenham and you walk around with 500,000 people in close proximity, I just remember looking at a couple of my clients and just thinking, this doesn't quite feel right. And the Friday, the last day of Cheltenham, that was it, and all sports had finished. And pretty much 2 or 3 weeks later, we were in our first lockdown. And I was really fortunate at that time. I worked with an organisation called Nifty Communications to do a lot of my PR, and I don't know if any of you guys know of an initiative we started called ISO Nation. And ISO Nation was really a collaborative project with organisations across the 3 counties and beyond, kind of create a space where everyone could share best practice, share how they were dealing with the challenge, and more importantly, putting some practical measures in to kind of navigate the new landscape. And we reached about 700,000 unique hits in terms of Facebook, LinkedIn, and YouTube. And as a recruiter, I speak to lots of MDs, and so all I do is speak to people about their biggest issue. And their biggest issue normally around businesses, either finance or people. I can't really help with the finance piece unless I'm recruiting finance people, but the people thing we can help with. And it became quite clear that everybody was really trying to find their feet around COVID. Now, by no means am I authority on all things COVID safe, but what I do understand, and because I've been immersed in this in the last 9 months for 70 hours a week, I understand how to provide practical safety solutions for people to kind of be able to trade profitably, to be able to minimise disruption, and to be able to maintain some level of commercial continuity. And that revolves largely around your people. So that was the essence of today. So thank you very much for allowing me to share my journey, and also some of the solutions that we've put into place for thousands of organisations over the last 9 to 10 months. So in terms of my point of reference, really, the first thing people said to me was, we don't know what to do. After people were able to start working in the office again, or where they weren't able to work remotely, people didn't know what to do. And the best thing to do, I always implore, is to have a look at the government website, which is obviously quite closely linked to the health and safety executive, around what you need to do to provide a safe workplace. There's lots of things that have changed over the last 10 months in terms of the new landscape. Zoom has been the new one. Zoom, we talked before, Jennifer and Yasmin were talking about, we're hoping that everyone arrives on time, and Jen said, actually, people are going from one Zoom to the next, and it's quite acceptable now to be 3 or 4 minutes late to your Zoom call because you're finishing off the last Zoom call. I think Zoom was a big one. Working from home is a big one. I work in a recruitment space, and most of my guys have got laptops. They've all got laptops, they've all got another screen at home, they've all got a mobile server on their phones, so they can dial in remotely on their mobile. So when it comes to working from home, we were quite set up for it. I work with a housing association that had to spend over £1 million on hardware because they'd never had any flexible working or people working from home, so that they had to buy the appropriate hardware and apps and software to allow people to work safely from home. So the kind of what I'm going to talk about today is the main areas that the government talks about around risk assessments, and obviously Jennifer and we'll talk about that in more detail. Social distancing, cleaning and hygiene, ventilation and air conditioning, working from home. But the big one is around vulnerable workers. And I think we need to talk about this because it's not just about making sure you've got 2 metre, you've got a one-way system, making sure you've got hand sanitizing. It's about making sure your people feel really safe. And the one element that we talk about there's a number of good things that come out of bad things. And the one good thing that's come out of it is that organisations have had to recognise their mental health challenges that organisations have and that their employees have. Working from home in a Zoom environment when you don't have your family around or you're a single individual, not being able to interact with people in a lockdown situation, that environment will make your individuals perform in a totally different way. So that's the premise of what I'm going to talk about today. And I suppose the vehicle for all of this for me as a business is a business called Covid Safe UK. And how that came about was I got approached by a number of people. There's a central government and local government incentive during the pandemic, in the heat of the pandemic. And they said for any organisations with entrepreneurs that clearly got some kind of initiative, they're able to turn things around, they're able to flex and pivot. There was a grant and it was called Pivot and Prosper. And essentially that was for organisations to pivot their business model and to support the COVID challenge. And essentially that's exactly what I did. So what I didn't want to do was just start a business for the sake of it. And what I didn't want to do was exploit the situation. What I wanted to do was do what I normally do when I speak to my clients, which is help them to maintain some level of decorum and continuity with the people that they've got. And so the first thing I did, I reached out to my client base and I spoke to a number of people, MDs, leaders of businesses, line managers and decision makers, and say, what's the biggest challenge? And what I then did was decide, actually, everything that I'm gonna provide in terms of services either has to be lab tested, scientifically proven, or endorsed. I don't want to be an organisation that just sells PPE. You can buy PPE from anybody. What I wanted to do was make sure that we had solutions that were accredited. So that's what I did, and I created Covid Safe UK. So I'm going to just talk briefly about some of the things that we do because they'll be relevant to your businesses. And don't think I'm going to talk at you for half an hour. I really want to make this as interactive as possible. I want it to be a discussion. So before I talk a little bit about Covid Safe, can you please let me know your name, and the business that you do, and the business name, your name, your business name, and the sector you operate in, because it will kind of help us. Because we've got a nice small group, we can make it the discussion as intimate and as relevant to you as possible. So
let's pop that in the chat, Nick.
Yeah. Sorry.
Do you want to put people to pop that in the chat for now, and then we can go through, or are you going to go around and
we can do that. Is that all right for everyone? So Tanya, you're the first one I can see. So unmute yourself and let us know what your business and what you do.
Hi everyone, I'm Tanya. I'm Director of Finance and Corporate Services at the Chamber of Commerce. So I'm obviously interested in keeping our staff safe within our premises, which we're not obviously using at the moment because we're all working from home. But that's the reason why I'm here today.
Fantastic. Okay then. Stacey, is it Stacey and Pam?
No, it's just Stacey. I did something with my mother-in-law and I can't change my name for it for some reason. So sorry. Yeah, I'm the HR and Health and Safety Manager for Falcon Contract Flooring. So we do a lot of commercial flooring. Obviously not a lot of hotels at the moment, but we're still on a lot of construction sites. So more interested for that side of things.
Fantastic. Dawn?
Hi, I'm Dawn Hardman. I'm Director of Human Resources at the Herefordshire Worcestershire Chamber of Commerce. So we're very closely with Tanya, actually, and obviously we're always trying to keep our knowledge up to date with all the current guidance and restrictions so that we can obviously apply them as they happen in the workplace. So I'm here to learn as much as I can, really, about how we do that.
Fantastic. Sam Williams?
Hiya, sorry. I'm Health and Safety and Facilities Coordinator at Central Roofing. So just here really to gain, some extra knowledge.
Fantastic. Thank you, Sam. Paul Smith?
Yeah, thank you, Nick. Yeah, my name is Paul Smith. I'm from a company called Borwell. I'm really just stepping in until Andrea Borwell-Fox can join at 3:30. But yeah, really interesting so far. So my role within Borwell is business development, but obviously working remotely at the moment. So any hints and tips on best practice, always welcome. So thank you for that.
Thank you, Paul.
Thank
Dean
you.
Hazelwood.
Hi there, Dean Hazelwood, Kingsford Events, provide event management, event support and event health and safety. So it's joining this today really to see what other people are doing and hear your thoughts on things too.
Brilliant, thanks Dean. Mike Boxall. Hi Mike.
Good afternoon, Nick. Hi, yeah, Mike Boxall. I'm the MD here at SiteMark. We provide best practice benchmarking for facilities managers and the like. So we work in a range of sectors: public sector, private sector, commercial, retail, etc. So yeah, really interested to hear what you've got to say, Nick.
Fantastic. Cheers, Mike. Tracy.
Hi, I work for the Herefordshire.
Pieces around the virus element, but it's more anti-vax. So I'm just with the new strain of the virus, what a lot of people have done, what we have found is we've had a real increase in people using the fogging machines, because the fogging machines weren't so bad when you had to be within a metre of anyone to get it. What they're talking about now with this new variant and a number of different strains of the virus is that it stays around for a lot longer. So I would implore anyone, and again, no pitch from myself, just be very wary about deep cleaning, be very wary about how often you're deep cleaning. We stepped up our deep cleaning from once a week, deep cleaning to twice a week, just to make sure. And if anybody wants to talk to me offline, give me, feel free to reach out. But I think it's really important that people know it, because I think Trump had mentioned hydrochloric acid once, and it kind of put everyone off. So when you mention hypochlorous acid, everyone thinks it's the thing that Trump made the boo-boo about everyone swallowing bleach, and everyone got really confused about it. But I implore anyone that's sanitising, making sure that surfaces are clean, they use those. Another really cool thing is there's these door handle stickers you can get. So if anyone touches the door handle, they're clean. It does sound like really bad housekeeping, but it's actually really important, particularly for areas of high footfall. In terms of masks, I want to talk to you about masks because everybody knows about masks. Listen, I've got my own personal views on the mask. You need to make sure you wear the mask where possible. I will always ask people to have a look at the mask that you're wearing and to shy away from fashion masks. There are a whole host of masks out there that limit when you're breathing in what you're breathing out. Like, it's dangerous. Carbon dioxide is dangerous, and so as a result, there are masks which filter it. So it means that you're actually, if you're wearing masks for long succession or for long periods of time, that your blood levels are safe. So I'd implore to look at those. And equally so, there are some masks out there made of graphene. And graphene is a really, it's only 10 years old, graphene, but it's got really amazing properties, and amazing properties around filtration. So if anybody's breathing on you, I won't talk about masks anymore because everybody knows about masks. What I will talk about is social distancing in the office and how you keep people separate. So things changed from the 1 metre to the 2 metre. I suspect that will still be a moving feast. One-way systems are a really great way of making sure that you've got your staff adhering to it. So is everyone else doing one-way systems? If anyone's in the office, yeah. So just put your hands up if you are, because it's like the best thing in the world. And the best thing in the world, particularly with this new variant, is don't keep anyone in the same place. So if you're going to the kitchen, make sure we have a rota for kitchen. We can hear and see people, so no one goes, no more than one person goes into the kitchen at any one time. You don't have to do that with the toilets, obviously. They're unless they're male, and you can get more than, try and get one person to go at any one place. And then for desks, again, no shameless plug of my business. If you want to use Perspex, that's fine. If you want to use a safety screen, UPVC, that's fine. But I implore that you do use the desk shields when people come back to work. And things have changed now. It'll have been fine before if you've got people 2 meters away, but I would always implore you to have some kind of screenage where you've got people operating in the same proximity, within close proximity. Is everyone using safety screens if they're back in the office, or put your hands up for safety screens? And then please put your hand up for just making sure that you've moved people away, so you've kind of separated people and utilised the space. Okay. They both really work. What we said to our guys was, what do you want to do? Do you want to do the screens, or do you want to separate? Because you've got lots of office space and you've got loads of space. They wanted to be together, so they wanted to still have the same environment and the same vibe and the same energy. And so that's why we went for the screens, which is a more expensive option. But again, the one thing that the premise of everything around safety is, like, safety at any cost. Like, it's your staff, it's their well-being. Without your staff being there and present and feeling safe, they're not productive. And without that, you don't have a business. So as ever, I always talk to people, don't cut any corners around you creating safe environments. The next thing I'll talk about is certification and training. So Jennifer's going to talk about the ISO accreditation. What I wanted to do was, I spoke to lots of people, and people were saying, well, we're not sure what to do. What do we do when we get back to work? So what I've done is I've reached out to a training provider, and we've collated a back to work CPD level 2 training course, which people can do online. And once you buy the code, you can give it to as many people as you want, just to feel really comfortable that everyone's done that. People have just threaded that into their own compliant health and safety COVID book. The one thing that I've been really pleased with is the speed at which organisations have nominated a COVID designated individual. I think it's amazing. I think it shows real credence to the issue, but it also shows that everyone's using their initiative and it's really important to them. And staff need to know that the measures that you're putting in, you're not just putting in just to be compliant. You're putting them in because you want to make sure people have got that they've got a safe working environment. And the one thing I'll always go back to is communication, regular communication, to find out. Can I have a show of hands around people that you're liaising with, people working remotely? Are you still having the same level of contact with people, or do you have to kind of make sure that you schedule in that contact to make sure you've got the touch points? Put your hand up if you've still got the same level of contact as if you were working in the same office. And then please just put your hand up and let me know if you had to schedule in that time to make sure that you've got the touch points. And I'll say that because, when you're working with people, you can normally tell people's demeanour and their mood by their body language. When you're on a Zoom, everyone puts their face on. You never know what anyone's wearing. Most people have got pajamas on underneath their work shirt. But more importantly, you need to understand how people are feeling. And so we make sure we have a regular catch-up. Once a week we have the catch-up, and then I do a catch-up with people every other day, just to make sure, just to check in, just to make sure they're fine. When you're working from home and you've got a problem, you haven't been able to share it with a colleague, you haven't got a buddy system in the business, it's always really nice to have those points. So that will be my piece around the certification, because what Jennifer's got is the real deal in terms of ISO and in terms of an audit around making sure that people are uber compliant. But I won't steal her thunder. I'll let her talk a little bit more about that. The other thing that I've got is that we do, which is really cool. Like Jennifer, I did the Goldman Sachs High Growth Program, and I did the cohort last year. I graduated last year, and one of the guys that was on that course, he's got a business called Keystones, and they do AI and sensor technology for smart office solutions. So they can tell, everyone has sensors, they can tell how close anyone is. Alarms will go off if anyone's too close. They can tell if people are walking the right way around a one-way system. They can tell air quality, temperature. They've got a whole host of different applications, which is the next level, but it might be something, Mike, we talk about from a facilities management perspective if you're not already on it already. And we've actually sold 3 of those systems into organisations. They're normally bigger organisations. They're normally organisations with unlimited pockets and budgets, because it really is the next level. But I think for anyone that's doing the one-way systems, they've got hand sanitizing, they've got good ventilation in there, and they're also communicating it. We have our own individual in the business that will let us know, unequivocally let us know when we're not, no, there's someone in the kitchen, no, actually, you've not hand sanitized, you've come in this morning, you go straight back to the thermometer. So, and that person isn't the guys that are the COVID designated people. These are ambassadors internally in the business. You should have one in every separate area or desk where you've got people spread out because you need that. It's really key. And then the last one I'm going to talk about, which is, I suppose, it's the most prevalent one for me at the moment. It's the one that literally I'm working 80 hours a week on, which is the testing. So testing at the moment, the vaccination process is great. Do not get carried away that vaccination is going to happen in the next 12 months, because it's not. It's just not. I think it's largely impossible that everyone's going to be vaccinated in 12 months. I just think it is. So, and if it is, brilliant. And if I'm proven wrong, then so be it, that we get back to normality a hell of a lot sooner. What's going to happen is, as we get vaccinated, because people who are vaccinated still carry the virus, there's only one way until we get full vaccination that we're going to really still be able to navigate the landscape, and that's to increase the frequency of testing. Because the only way that you're going to know, not when people have got symptoms, but just to do it regularly. One of my clients got an email and a letter from Birmingham City Council saying that they have to have, or is in manufacturing space, they have to have their workforce tested twice a week. So watch this space, because it's going to be something that's going to come out. And again, not a plug, because you can buy tests from wherever, but I've got the only government approved tests. They're approved by the NHS and by the government. They take 10 minutes, they're rapid test kits. That's one, that's by the by. What we have got is we've got an app which has been very popular, which there's an app, each test comes with a unique QR code. And so when people do the lateral flow test, they'll do the test, they'll take a photo of that QR code, which is unique. They'll take a photo of the cartridge, and that will be their self-certification. So organisations can then log onto the portal behind the scenes and see where their workforce is. There's a traffic light system. So if you're tested every 3 days, you'll be green for 1 day, amber for 1 day, then red for the 3rd day. If it's a week, if it's weekly, then it will be the whatever your test frequency is, and you'll be able to go into the portal and find out who's tested, who's not tested, because they haven't tested or because they haven't sent a photo. And you've got to be really compliant, because I think that we're going to have a very similar situation to the no win, no fee issue in the UK. Again, this is just my views, that there's going to be, how long will it be before someone says they got COVID because of the work environment they had? It's not going to be long. And I'm in the process of getting insurance set up so we can do testing centres. And the insurance premiums are tens of thousands of pounds. And when you speak to these guys, they're talking about what the next wave of litigation that's going to come through. So, and this is not fear mongering at all. All I'm saying is, if you've got a workforce that's working remotely, but that has high levels of customer interaction, you've got a workforce that's working on site in manufacturing, engineering, or they have to work on site, the duty of care is on you as an employer. And so there's a duty of care from a compliance perspective, a duty of care from a employee well-being perspective, but it's the biggest one, and that's the one I wanted to kind of finish on, because that's the bit now that enables us to still work, to still function, to still operate, to still, given the restrictions on your sector, obviously in events and in hospitality, you guys are still going to have to wait. But as soon as we're all able to start kind of get the eye level at the right level, testing is the way forward. So I implore you guys to embrace it. You don't have to buy the test. If you're part of a larger organisation, you can get government assistance. You can equally send your guys to the test centres, but I would definitely be looking at weekly testing. And the only reason I say that, my wife's a teacher, and she got COVID on the 16th of December. And goodness knows how she didn't get it before. She's in a school with 700 boys in Birmingham, boys' school, and how she didn't get it sooner. Anyway, she got it, and as soon as she got it, I tested myself with my kit. So I was fine on the Wednesday. Did a deep clean in my office. Everyone got tested in the office. They were fine. I went home. I tested on the Friday. I was fine. And on the Sunday, I didn't feel great on the Sunday. And the Monday morning, I tested, and I was positive. And so you shouldn't have to wait till you've got symptoms before you test your guys. It's just really proactive. The tests they're very cheap, and it's just for peace of mind and to give yourself, to make sure you're compliant. I wanted just to kind of finish on the testing piece as something that we need to be aware of. Can you put your hands up, guys, if you are testing at least once a week in your business? And it's no problem, it's not an issue. If not, is there anyone?
I don't know if the tests have been that easy to get hold of so far. I think that's the biggest issue, isn't it?
Yeah, you're probably right, actually. Is anyone been utilising, for anyone with symptoms, the usual go to the drive and get the test? Then put your hands up for those. and it'd be really interesting actually to find out, put your hand up if you had an outbreak of COVID in your business, as in one person's tested positive. Okay. And have you had more than 5 people test positive? I know a lot of businesses are micro and SMEs, but okay, Ben, but your business is massive and you've got quite a large workforce. Okay. All right, well, listen, I'm not the authority on all things COVID safe, but I do know what I'm talking about in terms of products, and I do know what I'm talking about in terms of really practical premium solutions, because that's all we do. If anybody wants to have a conversation with me, email me or talk to me about any products they've got, you don't have to buy them from me. I'm quite happy to speak to you about where you can get things. There's lots of things out there. There's lots of misinformation. There's lots of really cool and relevant information. The only thing I'll finish on, because I'm just conscious I'm chewing into the time, is that your safety of your staff and building the confidence in them isn't just around safety solutions. It's around engaging with them. It's around talking to them. It's around making sure their mental health is looked after. And then you've got policies and you've got procedures in place that if you need to escalate things or you need to have any level of intervention, you've got them. And again, if anybody would like me to reach out to me from my employee engagement business perspective, then feel free to reach out to me and I'll give you the benefit of my time and advice. I won't charge you, and I'll spend as long as it takes to make sure that your guys are good. COVID Safe UK is about embracing the new normal. It's about getting back to the old ways, or as close as we can, as soon as possible, so we can all trade and we can all run our business again. So my mindset is really consistent around my approach and how I'm interacting with people. So please utilise me. I hope you found it useful, and feel free to, once Jen's finished, if you've got any questions, feel free, or put them in the chat. Awesome.
Lovely, thank you, Nick. I assume you're handing over to me at this stage. Yeah, he's put himself on mute, so there we go, I'm off. Okay, I'm going to share my screen with you because I do have some slides that I want to share with you. So hopefully you can all see this now. Can I just have a little wave to say that you can see my screen? Yeah, perfect. Okay, great. So for anyone that doesn't know me, and actually there's quite a lot of new faces to me on today's webinar, my name's Jennifer and I'm the MD of a company called ISO Quality Services. And predominantly we're a specialist in helping SME businesses through the implementation of ISO management standards and training. And I know there's a couple of businesses on here that we work with as well. We're members of the Hereford and Worcestershire Chamber, and we're a family-run business. And you know, like Nick said at the beginning, you know, I can pinpoint the moment that I started to look at this and figure out that this was going to change our business going forward. You know, in what way I didn't know back in March 2020, but I, you know, I definitely remember that moment. Nick, you were lucky you were at the races. I wasn't there, but I was back here quietly panicking in my office, I think, as many of us probably were. So getting into the actual certification then, so what is it? Effectively, what we're looking at here is a certification that provides a third-party assurance that your business has put in place the specific measures to not only mitigate the virus and the spread of the virus. I mean, we're quite lucky in this room by the sounds of it. We haven't had any major outbreaks. However, you know, it's always looking at how your staff feel, and Nick's kind of touched on that a couple of times within his talk. You know, the kind of the trust that you have. I can see a lot of you are still working from home, but there's going to be a point where we're going to need our people at some point or in some way back into the offices. So the certification here is as much for your employees as it is for your external stakeholders as well. And it's making sure that you've got that kind of that third party perspective of meeting those government guidelines. Now, obviously, the problem with the government guidelines, which again Nick touched on, is that they are changing all the time. So at any point in time, you need to make sure that you are compliant. The aim of actually having a certification around this really is to ensure that you're meeting your obligations by reducing the risk of transmission. Obviously, the government's big focus on is, you know, work from home if you can. So they are very much kind of positioned around reducing the risk of transmission, especially, as Nick already mentioned, with this new strain. The other aim of this is to kind of install that confidence and trust within your workforce that you are actually doing everything you can as an organisation to be COVID safe. Whilst there are many organisations that can operate from a work from home structure, there are also just as many that can't. And at the moment, that could be crushing operations. What we're looking at here is providing that kind of trust so that people can come back into work and feel confident that you've got their safety kind of at the forefront of your mind. Clearly, health, safety and well-being should be, as Nick's already mentioned, top of your priorities. However, and kind of reducing, people off sick and things like that is a problem that businesses face, outside of the COVID situation. The last thing your business needs right now, though, is people off work. If you've had to make redundancies, if you've got people still on furlough because of homeschooling issues, you may be left in a position of being marginally under-resourced. So the last thing you need right now is to kind of have an outbreak and to have your teams going off poorly. Keeping your staff safe, I think Nick just said it right at the end there, should be always prioritised and even more so at the moment. It should be able to provide you with external assurance to your stakeholders, such as your board of directors, if you have one, or your customers as well, and making sure that they're working with an organisation that's taking their kind of health and safety and well-being of their team seriously. And ultimately, the aim of it is to have that verification that you've met those government guidelines. The guidelines are there for a reason. You might not have the peace of mind yourself because, let's be honest, we've all read the guidelines at one point or another and thought, oh, what does that actually mean? Well, we come at it from a health and safety point of view. So one of the ISO certifications that we've been delivering for, 20 odd years is around health and safety management systems. So we're coming at this from a very much a health and safety perspective. So with regards to what's actually involved, so initially we'd be looking at holding a remote assessment of your key controls. Those key controls would include things like a current health and safety risk assessment showing that you've either added in COVID workplace requirements, or, as most companies have done, is actually put together a separate risk assessment for COVID requirements. Ideally, you should be able to prove that you have reviewed this on a regular basis and as regular as the government guidelines are changing, to be perfectly honest. We will be able to, at this point, remotely discuss with you any actions you've taken, and if you have had any instance, which a couple of you, have raised your hands to say that you have had a couple of positive tests, we'd like to know kind of how you coped with those, what the communication processes were around that. So effectively, we need to get a complete, warts and all view of what the current situation is for your business. What would happen if this happened? What would happen, if that happened? What would happen to the business if you had an outbreak of 5 or more of your employees? And this kind of remote assessment will take anywhere between 1 to say 3 to 4 hours, depending on how big your organisation is, what sector you're in, how much risk there is to you, effectively. And it will all be based on the government guidelines as they stand that day. So we'll be checking through any of your processes. We'll be checking to see that you've got all the, ask you questions about signage that you have, one-way systems, any correct PPE. And as Nick mentioned very briefly, but I'm sure you'll get more information after this, is around the training that you can implore into your employees. I mean, there was a couple of people, particularly from the chamber, where, you said that, it's your responsibility. Well, have you been provided with the correct training that you need in order to do that role? And actually, is there other training that you can do around health and safety that actually your employees need to know, just from a general perspective? Because I think this has really brought home the importance of good health and safety within organisations. So once we're satisfied that you have put in place the basic measures to be COVID safe, or to have a COVID safe workplace, we would actually need to come and physically visit and actually see these processes and these mitigating actions in place. Each individual site, so if you have more than one premises, we would actually need to visit each of those sites separately, because it's actually the site that gets certificated. And depending again on the size and complexity of your business, this would take between half a day and a day per site. And actually what we're there to be absorbed into the environment and watch the one-way systems going ahead, watch your ventilation, you know, kind of check all of those elements with you, and actually, you know, potentially provide you with some recommendations for things that you can do over and above the government guidance. To be fair, Nick actually spoke a lot about what you can do over and above, you know, this weekly testing. Now that the testing kits are able to be purchased privately, whereas before obviously you had to register through the government, I think that we will see a lot more businesses, you know, wanting to get their people back in to the kind of premises, and therefore this kind of weekly testing is definitely going to be something that, you know, along with Nick, that I think we're going to see more and more of, especially in those larger organisations where, you know, they have to have so many more people on site. We can give you any other help and guidance around processes. I mean, we're the process people, we're process and procedure people. So actually, you know, we're all around kind of making sure you've got the right documentation in place, making sure you're doing the right things and making sure that you're communicating it properly to your teams. In terms of what's actually involved, in terms of what you'll actually achieve. So once that site visit has been successfully passed, you'll actually get a certification to show that you have successfully verified to us that you are COVID safe and that you're operating in a COVID safe way. That will also come with a logo that you can display online and around the premises. And it's something that you can actually share with your employees, especially those ones that are a little bit more hesitant, shall we say. You know, everybody's got a different kind of risk level personally about how they feel about kind of going into work, you know, especially if it's kind of those environments where you cannot work from home. So having this is just that extra wraparound measure that can give them that peace of mind. It can also make you as an organisation sharpen up on what you're doing. And it's so easy, isn't it, 9-10 months on to get a little bit, well, I think towards Christmas, we all got a little bit more relaxed. Then obviously this new lockdown came and we've all tightened back up again, but it's making sure that you retain that same level on an ongoing basis, because everybody in your organisation is going to have a different feeling towards it, and you kind of have to be aware of that. So I put this slide in here, why bother? I don't mean about why bother being COVID safe, that's a given, we have to. Why bother getting the certification? We all know that having third-party endorsements helps us sell our products and services, and it works the same way for getting people's trust. Ultimately, what you are looking at here is it's not we've said we're COVID safe, so come on back and, you know, operate this machine, or come back onto the shop floor, or come back into, you know, our lovely chamber offices. Actually, we can prove that we've had somebody else, and, you know, bearing in mind, it's what we do. We audit companies from a process and a procedure, from a health and safety perspective, and it's been independently assessed. That's naturally going to put more confidence into your kind of workforce and your employees. But also I put on here about, think about your team's mental health. If you have had some form of resistance to coming back onto the premises, it's very likely they're going to be very cautious and want to know for their own peace of mind that you, as a management team, as a leadership team, have got their safety in the forefront of your mind. With regards to kind of physical health, Nick touched on it again, then they may be in a more manual job. They might not be in an office kind of, you know, where you can work from home quite easily. And therefore, if they're not actually working at the moment and you haven't managed to get them back in to work, their physical health will also be affected. And I'll come back to that around DSE and kind of home working as well in a moment. Ultimately, you know, we talked a lot about team confidence, but ultimately your business performance. Nick said it, your business, you know, in most cases is highly dependent on your employees, especially if you don't have that work from home option, especially if you're the type of organisation that has to have people in on site. The more people you can get back safely working, the better your business is going to perform. So I ummed and ahed about putting some costs on here, and I just figured everybody always wants to know, and that's the first question we're always going to get, is how much does this cost? And you know, Nick said it right at the very beginning, and people might not have caught it, but actually we're not in this to exploit the situation. We're in this to offer a very simple service for businesses to be able to get that third party. So we've kept the costs kind of minimal, really. So it's 450 for the initial remote assessment and 650 per site visit. Now, the other kind of organisations out on the market that are offering this are charging £1,000 a day. So we've kind of come in quite a lot like less, really, because actually we just want businesses to have that peace of mind. We're not doing this as a kind of a big profit margin or centre for us. It's trying to keep it cost effective for you, and ultimately we care about, especially the local business community, Hereford and Worcester, you know, being based in St John's, you know, we care about getting people back into work safely. So we're trying to do this very cost effectively, to be perfectly honest. So a single site can achieve it from, say, £1,100, and a dual site, for argument's sake, if you had more than one premises, £1,750. So I mentioned a bit earlier about, and I'm keeping my bit quite short and sharp, just in case there's any questions, and I don't want to keep you. So we talked a bit about kind of the mental health and the physical health well-being. We've all kind of seen the reports. I'm sure you all watch Good Morning Britain or BBC Breakfast or one of those that talks a lot about this mental health issue that is going to be kind of ongoing now that we've had this such a long period of work from home, which is, you know, obviously a massive issue and something that we all need to do our best to tackle. However, one of the things that I don't know if is as widely reported on is actually around physical well-being from working from home. So I'm talking here about kind of good DSE. Working from home is not actually conducive for good DSE, as very few people have the setup at home, the ergonomics of the desks and the chairs, the lighting, the air, the ventilation, as they would in an office. And although I'm completely for the benefits of working from home, there should also be an element of getting people back into their office so that their physical health isn't affected. You know, we've got it here. We've got some employees who just don't have the space in their homes to have a proper office setup. I'm quite lucky. I have a room dedicated to being an office, but not everybody does. And therefore, what about in years to come? Back pain, repetitive strain, you know, there's all these other physical ailments that could you know, affect your workforce in the long term. And I do think that kind of any business that's looking at moving towards, this is just a bit of my own, you know, Nick's put his own opinion in there, I'm going to throw mine in there as well. A business that is looking at moving towards a full work from home strategy needs to think about purchasing the proper equipment for their employees to be able to work from home. And again, this is something that you probably need to kind of move in, like look at in your budgets and kind of how that's going to affect you. I've seen a lot of businesses close their offices in our client base and completely work from home. So I'm just interested to know how businesses are going to think about their physical well-being of their teams going forward. So I've just popped our website up there for you to have a look at us or get in contact if you've got any questions. Like Nick, I'm happy to answer any questions that you might have regarding the certification or regarding kind of, you know, any of the bits that I've spoken about today. So sorry we have not hit our target of finishing at 1:45, but I have left it with 5 minutes for questions and I can see the chat flashing up. So I'm going to hand over to Yaz to see if she wants to field any questions.
Of course. Well, thank you both for presenting to us today. Nick, for sharing your experience with the group and best practice, and Jennifer for sharing your new certification, which sounds really good. So thank you both for that. I'm going to have a look at the chat box. We have got a couple of questions. So firstly, one from Dawn to Jen, I guess.
Yeah.
How many businesses in Hereford and Worcester currently have the accreditation?
Well, it's actually brand new. So this was something that Nick approached us about towards the end of last year. I think it was about October, and we've done some, so basically our time up until now has been researching it. Obviously we do a lot of 45,001, which for those who, sorry to use the term, but it's a health and safety accreditation, which we have included some COVID questions into our health and safety audits, as you can imagine. So at the moment, this is absolutely brand new. There is another organisation that has been offering it since about September last year. So it's very, very new, you know, as you can imagine, with COVID being only a kind of a year old, I suppose.
Perfect.
Can I just interject there, because just to reiterate, what Jennifer said around the costings. When I reached out to Jennifer, I reached out to a number of other organisations, and the £1,000 a day was cheap. Like some organisations were charging £12.50 a day, and I didn't use Jennifer because she was cheaper. I used Jennifer because she was aligned to what we were doing from a moralistic perspective. And there were organisations, all they were interested in was how many days they were going to be billing. So anyone that knows her business and knows her as an individual, if you're thinking about doing it, I implore you to have the initial conversation with those guys.
Fab. Thank you. Does anyone have any final questions before we close the webinar? Just while we're in the interim then, if anyone does have any, just pop them in the chat and I'll read those at the end. Before you go, I just want to go through the next webinars that the Chamber are hosting in the next couple of weeks. So on Thursday, we've got our lunchtime networking. So it's Thursday, the 21st of January, that's 12 till 1 p.m. Next Tuesday, we've got how businesses and young people can benefit from the Kickstart scheme. That's Tuesday, the 26th of January, and that's 3 till 4. And then the Tuesday after is the 2nd of Feb. We've got our HR forum. That's 10 till 11. I know we've got a few HR managers in here. So those are all free for Chamber members to join. If you want to book on, I will send a follow-up email and I'll pop those details on there. Just checking the chat box. Nick, interested to talk about some more COVID things? If you could drop me an email away from this and we can pick it up. Thanks to you and Jennifer for your presentations, very useful, which is really nice, some thank yous in there. So I think that brings us to the end. Thank you again to both of our speakers. I will be sending up a follow-up email. I'll include both speakers' details. And Jen, if you're happy to, I can circulate the slideshow too. But thank you everyone for joining. I hope you have a lovely evening and thank you to our speakers again. Take care everyone. Have a lovely evening.
Cheers guys.
Bye guys. Thank you. Cheers.